Hi, this is Sue Lucas-Smith from the University of Sydney. Welcome to the second video module on the case management taxonomy. In this second video, we will show you the taxonomy. So a taxonomy provides definitions, helps to explain the components, the relationships, for a common language and understanding. In this next figure, it shows you how we develop the taxonomy. In the left-hand column, you can see there are 4 steps in the development. Step 1 was a scoping study. So we looked at what the literature was saying and how case management was described in the literature, and we mapped the components. Step 2 was a critical review of international frames. We selected frames to support the structure and taxonomy to deal with the various components and the complexity around case management. We used 3 international frameworks. The first one was the broad perspective of health, the biopsychosocial model of health, which is codified in the World Health Organization International Classification of Functioning, Disability and Health. The second international framework that we used was the International Classification of Health Interventions, or sometimes referred to as ICHI, I-C-H-I, and we used the alpha version of ICHI. The third classification was DESDA LTC, DESDE-LTC, and that's a European classification of services for long-term care. So we used all of this information from the scoping study and the international frameworks to develop the beta version of the taxonomy, and that was step 3 in the development phase. We established and prepared for a nominal group of 11 experts in case management. We had 6 meetings with the nominal group, and we unpacked and packed all of the information and the components and the definition, and we came up with the beta version, the beta 2 version of the taxonomy, and you can see that in the right-hand column. And then step 4 was the feasibility of the beta version. So we used some case studies and we reviewed the alignment of the beta version to the international frames and revised the taxonomy. On the completion of the case study questionnaire, we had a final meeting with the nominal group, and that was then produced the final version of the case management taxonomy. At this stage, we called it the brain injury case management taxonomy. Phase 2, which is not discussed here, involved the dissemination of the taxonomy and an impact analysis of the dissemination. I mentioned before that we called it the brain injury case management taxonomy. The reason for that was that we developed the taxonomy with an initial focus on one health condition, that of brain injury. The reason for this was because of the impact of brain injury and how it potentially affects multiple domains of health and functioning. It can affect social participation, it can affect physical abilities, cognitive abilities, psychological effects, sensory effects, and certainly participation in life roles and community involvement. If the taxonomy was fit for purpose for case management with brain injury, this complex health condition, it was likely to be fit for purpose for many or any other health condition. For the taxonomy, we used the model of case management that was person-centred and community-based. The case management taxonomy has 2 trees, an intervention tree and a service tree, 2 related tables which provide the definitions for each tree, plus there's a glossary of all the terms and components. Taking the service tree that you can see here, we started with community-based case management service component, the inputs. In the DESDA LTC classification, case management and care coordination are A4, so we started there. We then went further and developed the tree that identified acute and non-acute case management. In non-acute, we then have non-mobile and mobile. Going further down the tree, you can see in mobile, we have low mobile and also high mobile. Low mobile refers to less than 1.5 days or pro rata per week performing case management actions across clients in the community, whereas high mobile is 1.5 days or more per week in the field across clients. For high mobile, the service tree is extended further to high, medium and low intensity. You can see the definitions which relate to the actions performed per recipient or client of case management. So high intensity is more than 3 actions per week per client. Medium intensity is between 1 to 3 actions per week per client, and low intensity is less than 3 times per month per client. Now we move on to the intervention tree in the taxonomy, the second tree. So this figure shows you the whole tree of the interventions or the actions of the case manager. On the left-hand side you can see the main actions or the parent categories. These are engagement, holistic assessment, planning, education, training and skills development, emotional and motivational support, advising, coordination and monitoring. In the middle column you can see the actions which relate to those main actions, or if you like, the child category of actions. There are 17 of these actions. Then in the right column we have the related actions, which are also relevant but are not core activities of case management. So looking a little closer at some of the main actions and related actions, look at the main action of holistic assessment. The child categories of holistic assessment, as you can see, are listening, observation, test, gathering information from other sources, and measurement of outcomes. Now, not all case managers might do all of those actions to assess. They may just gather information from other sources. Looking at planning, and you can refer to the glossary for the definition of planning, but we can see that the main action of planning also involves the children actions of preparation, facilitation and support of client planning, and planning long-term supports. As part of that, the related action of provide decision-making supports, it's a related action in the right-hand column because not every client needs decision-making supports. Some do. So it's linked to planning, but is not core activity of a case manager. Looking at the main action of emotional and motivational support, if you looked at the definition in the glossary, you would see that it involves providing the client and their family or others as appropriate comfort, empathy, or motivational support. But the definition clearly states that it's without using theory-based methods. So it's not counselling and it's not psychotherapy. Looking at one last example, that of coordination, the main action of coordination in the left-hand column, and then referring to the middle column, you can see that there are 7 children categories of coordination. So in the taxonomy, coordination isn't just organising things, it involves navigating, facilitating, advocating, collaboration and consultation, case consultation, maintaining feedback, and managing documentation. And then you can also see, because coordination is critical to case management, that there are also some related actions linking client support, resolution of issues, building knowledge, and bridging. So when we look at coordination, with every client, you mightn't need to advocate. For every client, you mightn't need to link or provide client support, such as attending a medical appointment with them to clarify medical treatment. So coordination isn't all of those actions and related actions all of the time. So we can see that not all case managers do all of the main actions or actions and related actions all of the time. What actions are performed when and with whom depends on the client, their context, and the context of the service. Also, in many circumstances, the actions of case management might be separated across positions. For example, one person may perform the assessment and planning, and another person the coordination and monitoring. It would depend on the model of case management. In a broker model of case management, or using our travel agent analogy, case management actions might involve assessment, planning, and some actions within coordination, but it excludes emotional and motivational support, training and skills development, and education. The taxonomy provides a common language for stakeholders. It provides a framework for better understanding the service context with the service tree, but it also identifies the interventions and the potential actions of the case manager and depends on their client context. It shows a relationship between actions to enable mapping of roles and responsibilities, and it can support client planning, decision-making and funding, as well as support the development of a typology of case management, for example, for different clients or services. Also, once you know what a case manager does, and importantly what the case manager doesn't do, then it's easier to identify and understand the skills required of case managers to inform the education, training and development of standards, and undertake comparisons or quality analysis. In this second module, you have learnt about the taxonomy and how it could be used. If you now watch the third video module, you will see some examples of how the taxonomy has been implemented and used in practice, in a case management organisation, for research around case management, and policy development and planning.